Well, good evening, everyone. So I am tasked with the daunting, task of talking about everybody's favorite post-dinner topic, research, right? Everybody's like, let's talk about research. But again, thank you so much, Angela, and thank you so much, Roy, and everyone from the board. I'm so excited to be here with you all tonight because there is so much exciting, there's so many exciting advances going on in the field of MS. So for many of you, especially some of our volunteers who are awarded tonight, first of all, thank you all so much for coming out, and thank you so much for your inspiring stories about living with MS. I'm always inspired to meet people who are doing so many amazing things and living with MS. But for those of you who have had MS for a long time, you know that there was a time, as Dr. Hemhill said, when there were no treatments. And so there's been so many advances in just a short period of time. And so I'm going to just talk a little bit about some of the advances over the past year and some of the things that are coming down the pipeline. And then I'll take a few questions at the end. All right, sound good? Yeah. Yes, okay, so for those of you who've heard me speak before, you know I like it when you talk back to me, okay? All right, very good. Okay, so next slide. Awesome. So the Society's vision, it is the largest private funder of MS research in the world, right? Which is huge. Also, there are many investments that have been made by the Society and funding of research projects that have accelerated a lot of our understanding about multiple sclerosis, and also the projects and the collaborations of the MS Society are not just local, but they're global, right? Because how many know there are many people living with MS all around the world? For instance, I just went to a meeting in Berlin and got to meet a lot of my colleagues who are doing amazing MS research all over the world. So those global collaborations are making a big difference, and the progress that we're seeing is offering different pathways to a cure and helping us to better understand this disease called MS. Next slide. All right, perfect. So what are we looking at when we're looking at research, right? So the understanding of MS has definitely evolved over time, but many of the things that we knew about MS in the 1900s or the 1800s are some of the same things that we know now. But what things are we looking at? We're trying to figure out why some people get MS and other people don't get MS. For instance, in my patients, I have some families where multiple people have MS. I have some families where that person is the only person, right? If you look at studies that were done a long time ago in twins, twins who have the exact same DNA, if one twin has MS, there's only about a 25% chance that the other one will. So there's something that's going on with the genes, there are other environmental factors, and so we're trying to figure out why some people get MS and why some don't. How about what is the cause of MS? Does anybody know what causes MS? Because I was going to say, if you know, I'll sit down. Okay? So if you know, let me know, because I don't know. So what is the cause of MS, right? There are a lot of different factors that we're looking at that increase the risk, but how do those factors work together, again, to cause one person to develop MS and another person not to? How do we stop MS progression? Many of the treatments that we have are very good at stopping or slowing the inflammation, right? So we're good at working on those relapses, we're good at treating that inflammation, but what happens with progression? How do we stop that, right? How do we keep the progressive part of MS from causing so much disability? And how about going a step further, how do we fix what's already broken? Right? So many of the treatments we have, again, try to prevent disability, so it really depends on where we catch you in that continuum or in that course of your disease. If we catch you very early, hopefully we can try to prevent disability over time. If we catch you after you've developed disability, then hopefully we can try to freeze you in time, but how do we reverse or fix what's already broken, and how do we reverse symptoms and absolutely promote wellness? So MS research is growing, all right, and this is a really cool graph or set of graphs showing the difference between MS research in 1988, all right, the number of papers that were published. So in 1988, there were less than 1,000 papers published about MS. 2018, almost 4,500 papers. Okay, so there's a lot of talk about MS, and there's a lot of research that's being done. And also, even if we look at clinical trials, there's been a significant increase in clinical trials looking not just at relapsing MS, but look at that second one, progressive MS. Okay, significant increase and the research being done looking at progressive MS, and then how about the last one, wellness and symptoms, okay? So that's huge as well. So not just about, okay, what can we do for people with relapsing MS when they start, what can we do to stop progression, but what can we do to help you live a better life on a daily basis, right? Until we find the cure. Perfect. So, what are some, I'm just going to talk a little bit about some of the research in a little bit more detail. So, in terms of progress and ways to stop MS, there are some lab studies that can help us, that have been developed to help offer clues to the mechanisms underlying MS. There was one research study funded by the MS Society that looked at the drainage of the fluid in the brain and suggested that maybe some of the drainage systems or the tubing or the piping or the plumbing maybe of the brain could possibly help lead to inflammation. And so how can we affect that to try to decrease inflammation and decrease new lesions? There also were some pathways that have been discovered looking at the B cells. Traditionally, if we think about MS and the immune system, we often think about the T cells, right? Everybody's heard of T cells. Often we think of T cells when we think of HIV, right? But with MS, T cells are kind of the attack dog, so to speak. So when we think of T cells, those are the ones that are going and chewing up the myelin and causing the damage and the symptoms that we see. But we're finding that the B cells, the other cells that kind of signal the T cells, have a very big involvement in how MS causes disease and progression. And so we're finding ways and pathways to affect those B cells to try to treat MS. And the new medication that was approved last year for primary progressive MS was the first B cell therapy that's been approved for MS. Okay, so we're finding different ways to attack MS in the immune system. All right, how about updated diagnostic criteria? So, basically, the new diagnostic criteria that came out in 2017 has allowed us to diagnose MS faster. So for people who've been diagnosed for over 20 years, a lot of times what we used to do in the past is you had a symptom, you come into the doctor, and we say, oh, we think it's MS, come back when you have something else, okay? That could be 5 years, 10 years, 20 years in between symptoms. Then we updated the diagnostic criteria, so we said, okay, if you come in with a symptom, we think it's maybe MS, come back in a couple months and we'll repeat an MRI, okay? And if you have new spots on the MRI, then that would diagnose MS, okay? And so with the newer criteria, we're able to diagnose a person even in one visit. If they have an MRI, they have symptoms, and the MRI shows new spots and old spots, we can say, you have MS, and start treatment. So basically, by diagnosing people earlier, we can again address and treat the disease earlier to try to prevent disability. At our most recent meeting in Berlin, there were a couple of studies or posters that were highlighted that looked at this new diagnostic criteria from 2017. And what they found was that people were diagnosed faster and the criteria was still accurate. So people were diagnosed faster, but the diagnosis was still accurate. Also, there was one study done in Europe that suggested in that population of patients in that particular MS center, the diagnosis of MS was increased by 25% in that population because people were able to be diagnosed more quickly with the new diagnostic criteria. And then also there was another study looking at children and found that the children in that particular MS center were diagnosed more accurately and more quickly. All right, other recent progress in terms of medication. Roy touched a little bit on the use of fingolimod or Gilenya, the first approved therapy for pediatric MS, which is huge because most of our medications are not approved for pediatric patients, and we have many patients who are diagnosed in their teenage years and sometimes even younger. So it's good that we have a safe option for those patients. Also, there are many new therapies in development. So there are 2 therapies that are currently in the pipeline, okay, meaning they have been submitted to the FDA for approval. One of them is siponimod, which is very similar to fingolimod or Gilenya in the way that it works. And that would be the first drug for secondary progressive MS. You can clap now. That would be huge, right? Secondary progressive MS is a form of MS that really has been very under-researched and not recognized. And so this would be a huge advance if we had something to treat secondary progressive MS. Also, there's another medication, an oral medication called cladribine, which was previously submitted for approval and rejected, but now has resubmitted for approval, and that would be another good option for a higher efficacy medication for multiple sclerosis. And down at the bottom, we can see a couple of other things: ibudilast, lipoic acid, and statins. Statins are medications that are used for cholesterol, and these are all being looked at to try to possibly decrease atrophy or shrinkage of the brain in progressive MS. So we're not just looking at traditional medications, but we're also looking at different types of medications, not necessarily ones that suppress the immune system, to see if maybe they can be added on to help the other MS medications to decrease brain atrophy. All right, also stem cell research. All right, everybody say stem cell research. Absolutely, this is a really hot topic, okay, in the field of MS. The truth of the matter is that stem cell research has been going on for a very long time, right? So over 20 or 30 years, we've been learning more and more about bone marrow transplant or stem cell research. Much of that research has been done in Europe, but now we're having increasing areas in the United States where people are doing that research in the US and in Canada. Absolutely. Northwestern. Absolutely. So some of the research that's going on is looking at who can benefit from stem cell research, but who would be the best candidate for stem cell research. Certainly over time, the improvements in the process have increased the safety. So previously, if you think 20 or 30 years ago, there was a significant mortality rate from stem cell research just because people receive chemotherapy, and that can be very harsh on the body. Yeah, and there was one study or one registry that was done in Europe that said between 2012 and 2016, there was only one person that passed away related to this research. So the process is improving. Also, there was a very interesting study that was presented in Berlin that looked at stem cell research as a first-line option for young people with aggressive MS. And so that was a very groundbreaking study because we've never really looked at it before as a first treatment option. And they have very favorable results. So there's a lot of work being done in this area. As I usually like to say, it's not quite ready for prime time, but it's very promising. And so we're looking forward to hearing more about stem cell research. How about other factors? So, when we talk about treatment of MS, I always like to tell my patients there's a part you play and there's a part medicine plays, right? And no medicine will take away the part that you play. So it's very important to look at what we call modifiable risk factors. What can you do on a daily basis, or what types of things that you do on a regular basis can affect your health and potentially affect or improve the quality of your life with multiple sclerosis. So another hot topic has been the gut. So we've been talking a lot about the gut over the past 5 years or so. So many people have always had questions about diet. One of the main questions people ask me when they're first diagnosed is, Dr. Williams, what should I be eating, right? And so we've not had a lot of, I would say, robust research about diet, but what we're finding is that the gut, okay, and the bacteria and different organisms in the gut educate our immune systems. And so as we're finding that possibly the things we eat may affect how those are processed in our gut, and that may then tell some person's immune system to attack, right, and to cause MS, and other person's immune system not to do that. So there's a lot of research going into looking at the gut microbiome, which is all of the organisms in the gut. And there were some very preliminary studies looking at animal models where if the gut microbiome was removed, those animals couldn't develop MS. And then when they reintroduce it and give it back, they could, right? So there's something there. Obviously, we can't remove all those organisms in people. I don't know why I'm kind of pointing at my abdomen here. I guess I'm thinking gut. Please don't talk about my gut. I do have a gut. But certainly, so we're looking at those mechanisms and trying to see, could possibly the things that we eat, or maybe probiotics or other interventions like that, help decrease the inflammation and the attack of the immune system. Also, a good friend of mine, Dr. Ellen Mulry from Johns Hopkins, had two very interesting papers that were presented in Berlin looking at obesity. And so she was looking at BMI, which is body mass index. And so we know that obesity is a potential risk factor for MS, but there's not really a lot of good information about what happens or how obesity may affect the course of disease. And so she had two interesting posters, one of which suggested that if a person had a higher BMI, right, so higher body mass index, the more obese a person was, or the more overweight, then they had increased atrophy or shrinkage of the brain if they have MS. Okay? And then there was also another interesting research study she did looking at diet, and it suggested that people with a healthier diet may have had less inflammation and less disease activity. So again, when we talk about things that we can do on a daily basis, certainly looking at obesity and diet may actually have a significant impact on the course of disease. All right, what other progress has been made? Certainly looking at steps causing the nervous system damage. There's still a lot that we don't know. The immune system is very complex. We often talk about T and B cells, but there are numerous other cells that may be involved in inflammation and causing MS. Also, one of the things that has been very extensively researched that we haven't quite found is everyone's looking for what we call a biomarker of disease activity. Okay, so the biomarker is kind of like the holy grail of MS. So every time I go to a meeting, we have a big session about biomarkers, and everybody leaves confused, right? Because basically we hear about all this stuff, and then everybody says, well, it's called NFL, so it is not the National Football League. So some of you may be trying to go home and watch the National Football League. But so NFL is a component, a neurofilament light chain that can be released when there's damage that's occurred in the brain. It is not specific to MS, it can occur with brain injury, but there have been a lot of studies that have suggested that this increase in levels of this marker may be related to relapse and may be related to disease activity. So the potential is if we could find this marker and use it, could we tell if you're having a relapse by doing a blood test? Or could we tell if your medicine is working by doing this blood test? So if the levels are too high, does that mean your medicine's not working, or does that mean you're having a relapse? Okay, so it's not there yet, but it's very promising, all right? Okay, and other recent progress, this is another medication, evobrutinib, that looks at treating B cells. Remember, we talked about the B and the T cells, and this medication is actually very unique because it doesn't actually kill or remove the B cells, it just basically stops them from working. And so when we think about some of our our drugs that we consider more effective, many of them remove or deplete or kill certain cells. But in this instance, this would be one that would just inhibit the activity of the cells, which would mean it wouldn't suppress the immune system as much, okay, probably put people at risk for infection. And also it's a very unique mechanism, so there are no other medicines that work by this mechanism. So that's very promising. It's in very early studies, but the initial research results were very promising. And then finally, sartrilizumab, say that 3 times fast, I'm just kidding. Sartrilizumab is a medication that has shown very promising results in NMO. Has anybody ever heard of NMO? Yes, raise your hand real high. Only 1 or 2 people? Okay. So NMO, or neuromyelitis optica, is a disease that is very similar to MS. It actually used to be included kind of as a part of MS, kind of on the MS spectrum. But once there was an antibody identified for this disease, it became kind of a separate disease. So essentially, it's an autoimmune disease, just like MS. It causes demyelination, just like MS, but it mainly affects the eyes, the nerve to the eye, and the spinal cord. So it spares the brain, okay? So it basically is almost similar to MS, except we don't see a lot of brain involvement. And the fact that this drug showed some promise as a possible therapy for NMO is very good because there are currently no approved treatments for neuromyelitis optica. Okay. So that will be very promising. All right. And then in terms of restoring function, there are multiple studies that are being done looking at myelin repair. Unfortunately, a couple of years ago, we had one medication or drug that was very promising for myelin repair, did not meet the primary goals for the research studies. so that one was not approved. But certainly there are several trials that are underway looking at myelin repair and repair of the nerve cells, and also looking at different processes to see how can we possibly protect the brain and protect the nerves, and also what kind of other discoveries can lead to clinical trials for myelin repair. All right, so we're going down the hill now. So in 2018, the Society invested $36 million, okay, toward MS research. Again, we talked about training and building a research workforce, forging those global collaborations, and then Roy talked a little bit about the International Progressive MS Alliance, which is looking to find ways to treat progression of MS. Okay, clinical trials are underway that the society is supporting, include several of these things. I'm not going to read them to you. I know you want me to read them to you, right? I'm not going to read this. I'm not going to do it. So just to touch on a couple, dietary approaches to treat symptoms like fatigue. Would anyone love to have a better treatment for fatigue? Yes, absolutely. So looking at ways to treat fatigue, looking at statins. Okay, those are cholesterol medicines and secondary progressive MS. And also looking at other supplements like lipoic acid, biotin, and vitamin D. And then certainly looking at the gut and looking at ways to decrease immune activity. All right, so what else can we do to help people living with MS now, right? While we're waiting for all of these studies and research trials to give us results. Certainly we're finding that exercise can help MS symptoms. We're also looking at ways to address other medical conditions because things like diabetes, and as we talked about, obesity can affect the course of MS, smoking as well. Also looking at resilience, right, because it can improve quality of life. And also there are other society-funded studies looking at diet and how that can improve symptoms of everyday life. Perfect. So I will end with this. My favorite saying, all I need is peace, love, and a freaking cure for multiple sclerosis. Thank you very much for your time and attention. I made it. Nobody's asleep. I've done my duty. Okay, so I'll take just one or two questions, and then I will hand it back over to Angela. One or two questions, and I ask that if you have a question, please make it something that would apply to the whole audience. I can't give you specific medical advice, but if you have something that would apply to everyone, I'm happy to try to answer that for you. Yes, ma'am.
I've heard of 10 different medications that were available for treatment for MS. Today I heard my doctor give me another name, Ocrevus.
Ocrevus, yes.
And,
like okra with a buzz on it, but not spelled like okra.
And so that is not an 11th, that wasn't on the 10th?
Yes, so Ocrevus was approved last year, okay, last year, 2017. So it was approved last year as a treatment for relapsing MS and for primary progressive MS. So that is the newest approved treatment for multiple sclerosis. Yes, ma'am. And then hopefully next year we'll have 2 more to add to that list.
Thank you.
Yes.
What can you tell me about Botox for walking?
Botox, right? So Botox has many uses aside from just crow's eyes and wrinkles, right? So Botox is used for a lot of different things and used for several things related to multiple sclerosis. Primarily, basically what Botox does is weakens the muscles, right? So that's why it decreases wrinkles, because it kind of weakens the muscles so that we don't see kind of the scrunching of muscles. So basically, it can help with spasticity, tightness of the muscles, okay? Another common use of Botox is if people have bladder issues. Sometimes Botox can help with the bladder. So, but it's primarily used for spasticity, and if people have significant spasticity, then it can potentially improve walking if that's an issue. Okay. Yes. Yes, sir. How are you? Good. Thank you for coming.
Stem cell versus medications. Let's slow it down. Which way do we seem to be leaning?
Right now, well, so the question is stem cell versus medications. Which way do we seem to be leaning? Well, right now we're definitely leaning toward medications, right? So even with the advances and improvement in stem cell therapy, it is a very rigorous procedure, right? So it's not like you just go to the doctor and get a stem cell transplant, right? So essentially you have to get your cells harvested, you have to get chemotherapy to wipe out your immune system, and you get the cells back. So it's a very rigorous procedure. So I think that even once it is approved, and I do hope that it is eventually approved as a treatment for MS, it probably will still be a narrow group of people that it will really help. Okay, so I don't think that it would eventually replace our disease-modifying therapies. Yes, ma'am.
Only because you mentioned it in the same sentence.
Uh-huh.
Has there been any studies that could relate diabetes with MS?
Studies that relate diabetes with MS, meaning as a cause of MS?
Or some relation and correlation
So there's a lot of work, well, there have been studies that have looked at the prevalence of diabetes in people with MS, and so people with MS do often have other, what we call comorbid conditions, so MS may not be the only disease they have. Certainly if we're talking about obesity, which oftentimes type 2 diabetes is related to weight and diet, then certainly that could correlate with MS activity, because as we just saw, we talked about how obesity could potentially worsen the course of MS or lead to more shrinkage in the brain. Okay, very good. I'll take 2 more questions, because my shoes have a time limit. I know my shoes. So I'm going to take 2 more, and then I'm going to sit down. Yes, go ahead. Yes, ma'am. Yes, ma'am.
What is your opinion about ABCs versus the oral and changing if you are having no problems with one of the ABCs, especially with companies trying to push the orals because they're cheap?
Right, so great question. The question is about the injectable ABCs or ABCR, our platform or injectable therapies versus our oral therapies. So I will preface it by saying I cannot give you specific medical advice. But what I will say is that every person with MS is different, right? If we went around this whole room and everyone told their story and told about what happened with their MS, everyone's different. So the solution or treatment is going to be different for different people. My general philosophy is if it ain't broke, don't fix it, okay? But certainly there are some instances where medications need to be switched because maybe they're not effective, maybe people have difficulty taking them, and so that's a conversation to have with your doctor. But we generally don't switch medications just for no reason if they're working, if you're taking them and everything's okay? All right, I'll take 1. Wait, did I miss anybody? Okay, well, I'll take 2 more. Okay, you, and then I'll make sure I get you. Okay, 2 more.
How do you feel about marijuana therapy?
Okay. Everybody wants to talk about Mary Jane. Okay, here we go. All right. Just messing. I know I'm just messing. Okay. THC components or cannabinoids. That's a very hot topic with MS. Now, if we look just kind of strictly at the research, much of the research has been done with the oil forms of cannabinoids, right? So the primary form that people use here in the U.S., at least in my clinic, is the smoked form, right? But the majority of the research has been done with the oil forms. If you look at the research, there is some suggestion that some symptoms may be improved, primarily nerve pain and spasticity, okay? So it is not a disease-modifying therapy, okay? So it does not treat the immune dysfunction, doesn't treat that. But if people have significant spasticity, or if they have nerve pain, sometimes it can help with that. I think that there's still a lot of research that needs to be done, especially with the smoked form, right? Because the THC can cause cognitive dysfunction or cognitive impairment, right? So we have to kind of balance the risk versus the benefit. So since it is now legal in certain parts of the U.S., I do believe that we'll have more research where that is concerned. But the oil form does seem to have some improvement in spasticity. The other thing that was interesting is that if you look at the studies, the improvement in spasticity was subjective, meaning people felt better, but when they were examined by their physicians, their exam was about the same. Okay, so it was more of kind of an internal feeling of improvement, but it wasn't necessary. It didn't necessarily translate as well into like physical changes in their exam. Now that doesn't mean that that's not significant, right? Because it's important for people to feel better. But basically, there's still some work that needs to be done. Okay, and so we'll see what happens.
I have a friend in Puerto Rico that was in an accident. He's going, he smokes weed every day, and he's doing great.
I bet he is.
I'm sure he
is.
Yeah, so you on your way. Okay. All right. Okay. All right. Last question. Yes,
I
sir.
haven't heard a lot about aminopyridine 4AP.
Yes.
Been on it since 1980.
Absolutely.
And I was taking, right now I take 25 milligrams twice a day. And my experience, it's what's given me a lot of help with fatigue. So I guess why don't they offer that at a higher dosage with where I'm at?
Okay.
Because right now there's only 10 milligrams.
4AP. So 4AP or 4-aminopyridine is it's a compound that's been used for a very long time in the treatment of MS. Now there is a branded form called Ampura that was approved for walking dysfunction to help walking speed with MS. But we've been using 4AP forever as an adjunctive therapy. So basically, there were some preliminary studies. So it actually has been studied in a lot of different areas. It's been studied looking at visual function. I'm not sure about studies with fatigue, but certainly the one that got approved was the indication for walking dysfunction.
That would have been.
The reason that the dose is not usually higher is because of risk of seizure. Right? So the dose for 4-aminopyridine Ampura is 10 milligrams twice a day. And I do have other patients who say, Dr. Williams, I really feel like it helps. Can I go up on the dose? But there's concern about risk for seizure. And so that's the reason.
Lava doesn't really like for me to be on it.
Yes. So that's the reason that the dose is not high.
I do a lot better with it.
Some
Talk
people,
about fatigue.
yeah, some people it definitely helps significantly. All right. Well, thank you guys so much. Thank you for staying awake and engaged. I will hand it back over to Dr. Corbin, and I'll be around for a couple minutes after the program if anyone has any additional questions. Thank you.
Amazing, right?
Yeah.
Thank you. Thank you all so much for coming together to be with us today. We cannot do the work that we do without you. Thank you for your support, thank you for your dedication, and thank you for your time. This has been a wonderful day to partner with each of you. The work of the National MS Society would not be possible without you, so again, I want to say thank you. Behind me, Toy, you can go to the next slide. Oh, okay, well then there is one next slide. I thought it was a resource side. One of the things I would really encourage you to do is go to, I'm going to get out of the way, thank you. Resources and support for MS. So the National MS Society has a lot of resources that we want you to take advantage of. You can visit these websites, the National MS Society support groups. Georgia has 26 self-help groups, support groups, and I have made my way to just about all of them. Like it was said, if you try one and that one does not work for you, try another and try another. There are different support groups out there. They're all across the state of Georgia, so again, I would encourage you to go, just try it. When you go to self-help groups, you don't have to talk. I know some people say, well, I don't want to talk. You can just go and listen. You can just go and maybe meet a new friend, shake a hand. But I would encourage you to get help. Do not suffer in silence. And I know sometimes that could, what did you say? You agreed? Yes, you agreed. Do not suffer in silence. You don't have to suffer in silence. Even if it's just one person that you connect with, that one person can make a difference in your life. So I would really encourage you to look at our self-help groups. If you have any questions, you guys know that I'm always here for you. You can call us. Any staff member here in Georgia, and I'm going to acknowledge our staff members. We work together as a team to do the best that we can to help everyone get the resources needed. Another resource that you can have is that one of the things that I was able to do in Georgia is I was able to expand my portfolio by 4 programs. You guys asked for programs, different ones around the city, but I have not had a program in Marietta, so it made my heart smile to be able to have a program here. But if you go to the National MS Society.org/calendar, you will find information on our walk events, on our MS walk events, our MS bike events, as well as our programs and a lot of the other information that we have there. And again, I would really encourage each of you to call the MS navigators. They take their time. I have been on the phone assisting some of them, and some calls last 3 minutes, some calls last 30. Some calls last over an hour, but they are resilient in trying to make sure that a person has what they need. So again, I just want to say thank you very much for coming to the program tonight. Give yourselves a hand, and we look forward to seeing you soon. Roy, I would like to bring you back.